Hello, my name is Brooke Ward. I'm the President and CEO of the Washington Health System, and I'm honored to be back with you today for one of our videos. Now, we are off cycle again today because we have some good news for you. We're getting ready to move into Phase 1A for those individuals who are over the age of 65 or under 65, ages 16 to 64, who have underlying health conditions. We're very happy to be able to bring the vaccine to our community and our neighbors to get this done as quickly as possible. Now, you might recall the state surprised us on January 19th by making all these people eligible. And we were not ready. We were preparing for that, but we were not ready. And so instead of rushing ahead and putting a process in place was difficult for you, we already had our vaccine schedule full of people who already qualified in Phase 1A. And so we left them on the schedule and we continued along. But we've been using this last week or so to prepare, to get ready so that we have a smooth process for you. And that's going to happen today. We're very excited to bring this to you. So today on our website, if you go to whs.org/COVID, you'll see a link where you can sign up to request the vaccine. It's pretty simple. It's going to ask you a couple things. One, it's going to ask you, do you qualify because you're over 65 or have one of those underlying health conditions? Then it's going to ask you for your name, cell phone, date of birth, your email address, your home mailing address, which location you prefer, and which day of the week you prefer. And if you have no preference and you can go to any location or any day of the week, you can sign up for that as well. Now, once you get complete, it's going to send you a confirmation email. Now, please be patient. That is not going to happen immediately. It could happen a few hours later or as long as a day later. We're going to automate it as much as we can, but there's going to be certain people who are not active patients with us that's going to take a manual intervention. And so if you apply over a weekend, it might not be till Monday you get a response, but we will get back to you. Please be patient. Please keep in mind now, there are over 80,000 people in Washington County alone, and probably another 10,000 in Greene County who qualify for Phase 1A, and there's just a few of us. So we're really asking you to be patient. We're going to work on this as quickly as possible to help you get through. As part of that, being patient, please don't call, email, text as a follow-up to confirm whether or not we got your confirmation. You will get that confirmation email. Now, we're fully expecting the website to crash. We've been talking to other hospitals, other healthcare providers who have set this up, and they're all experiencing that. And so we expect that to happen at least during the first week. So again, be patient. If the website's not working, check back a couple hours later, check back the next morning. We'll get it back up and running as quickly as possible, but we're going to be overwhelmed. We realize that. When you do get your email that talks about your date, so you're going to get that confirmation email, but then when it's your time and it's first come, first serve, so it could be weeks, it could be a month before we get back to you. When you do get that email telling you it's your turn, we're going to give you a date and a time and a location based on the preferences you told us in the registration process. We don't have the manpower to take phone calls and requests to modify that and change it. Again, remember, there are hundreds of thousands of you. There are over 200,000 people in our county. There's just a few of us on this end. So please make arrangements to try and be there. Now, if you can't be there, or maybe you've already gotten vaccinated somewhere else, in that confirmation email, there's going to be a link you can click to cancel your appointment to help us on our end. Now, we also understand there's a number of you out there who may not have internet access, or you may have family and friends who don't have internet access. We understand that this is going to be a challenge for them, so we're calling on all you to help them. So neighbors, family, friends, if you can help enroll your individuals, your family and friends who don't have internet access, that would be great. For the few folks who don't have help in that regard, please call your primary care physician. For the physicians who are affiliated with us, either employed by us or on our medical staff, we're going to have a process through the office where we can collect that information and get them set up manually. But we're requesting and hoping everybody uses the website as much as possible. Please don't try and circumvent that process. It's going to be the best and most efficient way. And as you already heard me say, remember, there's a few 100,000 of you in the county and a few of us here, so we're going to work on this as quickly as possible. Now, a little note about the locations. We're already doing the vaccine here at the Washington Hospital in Washington, Pennsylvania. And on February 18th, we're going to relocate that, remove it from the hospital. We're going to take it out to the Crown Center Mall in a big, large space so we can get as many people in as possible. That move is going to take place again on February 18th. In Peters Township, we're going to open a new site. That site is due to open on February 22nd. And then in Waynesburg, we've been running a vaccine clinic within the hospital there. We're going to relocate it to a larger spot within the hospital. That relocation happens on February 15th. And once we get all three of those sites up and running in bigger locations, Again, all COVID vaccine dependent, but we're hoping to run those clinics Monday through Saturday, 7 a.m. to 6 p.m. every single day. Now, keep in mind, we're only taking appointments. No walk-ins, no trades, and if you do get an appointment, don't bring a family member assuming we'll squeeze them in. It doesn't work that way. It's only by appointment only, and we're going to be really firm on that. I apologize. I know people want to be flexible, but it is what it is at this point. We're also not taking walk-ins because we don't want people standing outside in the cold for hours on end hoping to get in. Scheduled appointments only. Lastly, point of note, we're only taking care of people who live in our communities. This would be people in Washington and Greene counties. We've been getting requests from Illinois, New York State, South Carolina, Dominican Republic. We're not doing any of those folks. There is an allocation across the state and the federal government for the population in each county. So you should get your vaccine ideally in the county where you live. That helps the allocation and the distribution of the vaccine statewide work better. Now, last thing I just want to say, our next scheduled video is supposed to be on February 5th. I won't be able to be with you on that day. Dr. John Six is going to fill in for me. He'll do a great job, and you'll get the normal updates on February 5th. Look forward to Dr. Six doing that. And lastly, on behalf of the Washington Health System, I just want you to know we're very proud to do our part to help fight the pandemic here in our communities, and we're hoping to take care of you very soon. Thank you, goodbye, stay safe.